New data released today from think tank secondstreet.org indicates that the number of Ontario patients that died while waiting for surgery, CT scans, and MRI scans has risen significantly over the past 5 years. The largest spike occurred from 2021 to 2022 across all scans and procedures, with over 5,000 patients dying while waiting for a CT scan. Past research suggests that most patients likely died while waiting for procedures meant to improve their quality of life, such as hip and knee replacements, rather than life-saving, such as a heart operation. Many provinces, and even some Ontario hospitals, have released more information about waiting list deaths, but Ontario Health has refused to release similar information. Well, joining us today to discuss this research is Mr. Colin Craig, president of secondstreet.org. Welcome back to Forum Daily.
Thanks for having me.
Pleasure. Can you give our viewers a brief overview of the recent report that your organization just put out today?
Yeah, so it's been known for a number of years in Canada that from time to time patients will die while waiting for surgery and diagnostic scans. And so we've been researching this issue for several years now. And today we released some data that we got from Ontario Health that looks back, depending on what you're looking at, seven to about 12 years. And it shows a steady increase when it comes to patients dying while waiting for things like MRI scans, CT scans, and even surgery. So it's concerning. Unfortunately, they just give us the big totals. They don't give us a breakdown as to what's actually happening. So, for example, in Nova Scotia, when we get the data from them, it shows us for each case, how long patients are waiting, what they're waiting for, and so forth. And they can even dissect just how many patients died while waiting for procedures which could have potentially saved their lives. So something like a heart attack versus something like, or heart surgery rather than something like knee or hip surgery. So Ontario Health, they're not giving us full data there. We certainly hope that they have it somewhere, but we think it's important for them to be accountable and to disclose this information to patients so that people can understand just how much patient suffering is going on.
I suppose from your research, from what you've been able to uncover, would you know what's behind the spike in waiting list deaths in Ontario?
I think really at the heart of this is government mismanagement. When you look at the numbers, you can see they've been increasing for a number of years, well before COVID even hit. It's been a growing problem. And, in this country, we have a long history of just simply politicians throwing more and more money at the healthcare system, hoping it works, without actually reforming things so that things will work better like they do in other countries. And so, that really just hasn't materialized. We've seen more and more spending. We've seen this problem continue to grow and grow and grow. So I think that's really at the root of this problem is just we haven't seen meaningful health reform to improve outcomes for patients. COVID made a bad situation worse. It as governments postponed hundreds of thousands of surgeries and diagnostic scans, it just created a huge backlog. So that's been a cause. That's been a problem. And then the other significant factor is that we have an aging population in Canada, and it's just a fact of life that as we get older, we need more and more health services like diagnostic scans and surgeries and so forth. So we've got all these factors competing or contributing to a significant and growing problem.
I know the reports about Ontario it's focused on Ontario, but do you have any comparison or reference for how these numbers in Ontario compare to other provinces across the country?
Yeah, so across the country, we have seen an increase. It does appear to be a growing problem across the country. I would expect that the situation is probably going to get worse because we do have this huge backlog of surgeries and diagnostic scans in the country. Governments are trying to address that as, like I say, we have this aging population, which continues to put more and more strain on the system. So, certainly I hope for the sake of patients that we see some health reform moving forward sooner rather than later, because ultimately that could improve the health outcomes that patients receive from the healthcare system.
You talked a little bit of reforms, and I know Second Street has looked into this in the past. So do you have any recommendations in a quick 30 seconds or more what policymakers could do to address this?
Yeah, I think the first step is to track the data very carefully. A lot of provinces don't do that. There's certainly room for improvement in Ontario. Track it and disclose it. Inform the public. Be accountable about what's going on, especially when it comes to how many patients are dying because they're not getting the care that they they need. Governments should absolutely be transparent about that. And once they have that data, that will help show where the problems are, areas are that need to be fixed.
Well, lots to keep in mind, and transparency, of course, a conversation for another interview down the road, perhaps. Mr. Colin Craig of secondstreet.org, thanks for joining us today on Forum Daily.
Thanks for having me.